Hi, and welcome to the Wellness Exchange. Today we spoke with Dr. Catherine Treviño from Palm Valley Dental. We spoke about dental hygiene and how it can affect your health. We hope you enjoyed today's video. If you haven't already, make sure to subscribe to our YouTube channel and like this video. Thank you so much for joining us today, Dr. Treviño. So we can go ahead and jump into it. So why would you say dental hygiene is just generally important for our health?
Great question. So the mouth is the entrance to the body, and anything that enters our mouth through either our bloodstream or our teeth, and the blood supply in our teeth goes into our body. And so it's very important to keep good oral hygiene to prevent cavities and also gum disease, to help prevent risks for infection or disease in the body.
Wow, okay, so I didn't realize it was connected to the bloodstream so closely.
Yes.
Wow, that's really interesting. So I guess you can definitely say it's important for people to visit the dentist. The recommended number, right, is twice a year?
Yes, ma'am.
Okay.
So we recommend twice a year to check for any disease processes that might be starting, any cavities that might be starting. We also look for things like signs of oral cancer, and we can tell certain vitamin deficiencies that might be present just by looking in the mouth that the patient may not otherwise know. So it's a good idea for a good oral hygiene and overall oral health and overall health to see your dentist at least twice a year.
Wow, so the mouth really is kind of the center, the starting point to everything. And definitely because teeth are made up of bone, right? It's a type of calcification.
So your teeth are inside of the bone, but each of your teeth, if it is alive, has a blood supply and a nerve supply that is connected directly to the rest of your blood vessels and nerves. And so that's why it's important to make sure that bacteria doesn't get into those areas to help prevent further disease and issues.
Wow, okay. So what would you say are some early signs of dental trouble?
Right, so one of the most common signs that we'll get are patients start having sensitivity, whether it be sensitive gums, so they get like bleeding, a bad taste in their mouth. They may also notice that they're having discomfort when they're chewing, hot or cold sensitivity, and also just in general, something that doesn't feel just right. And so if you have any of those symptoms, you want to make sure you see your dentist.
Yeah, definitely. I mean, sometimes I know I definitely struggle with sensitivity. So sometimes even a cold wind will I'll be like, oh, okay, that hits a weird spot in my tooth, maybe it's time to go in or something to get a cleaning.
Yes, and there could be something going on that you don't know, like you could have a crack on one of your teeth, and that's why the cold, when it hits that area, is causing sensitivity. Or you could be clenching your teeth. You could have broken fillings, things like that.
Yeah, and we definitely know that our employees that struggle with high stress jobs, especially our law enforcement, those of our employees who deal with people, the general public on a day-to-day basis are in a high stress situation. So I'm sure a lot of them are dealing with that strong clenching of the jaw without realizing it.
Yes, and especially during sleep. That happens a lot of times, and patients are waking up with headaches, and then they figure out, I'm clenching my teeth all day long, or I don't even know that I'm doing it, and they get muscle tension, and so that can cause all sorts of damage.
Yeah, absolutely. So kind of jumping into another type of, I guess, problem area, which is gum disease. How common would you say? I know you mentioned it earlier. How common is gum disease?
So gum disease is extremely common, a lot more common than people think. So over age 30, about 40% of people have gum disease.
Wow.
It gets a lot higher when we get past 65. It's about 75% of people have some form of gum disease, starting at gingivitis, when bacteria is left under the gum tissue. It forms hard, kind of like plaque that becomes tartar. And that's when a dental professional needs to remove that. And if it's left there, then that actually causes destruction of the bone, lead to bone loss, and long-term loose teeth, inflammation in the mouth, and bacteria, all about that.
Wow, that's crazy. Yeah,
so it's very common, especially
so
in our area. We have a huge population that are diabetics, and also the Hispanic population in general. We're more at risk to having gum disease genetically. So confounded with diabetes, it's extreme. I would say 1 out of every 2 of my patients over 60 has gum disease.
Wow.
Yes, and that gum disease actually puts them more at risk for inflammatory diseases like heart attack, stroke, diabetes, and now we know dementia and Alzheimer's. There's a huge link between gum disease and the bacteria that's in the mouth and plaques found in the brain, and that link is a newer link.
How interesting. That is crazy. I feel like people, well, I mean, generally speaking for myself, you know,
Right.
like just not realizing how linked your teeth are to everything, you know, and just, I'm sure that your teeth health, the saliva in your mouth, right, is just
Absolutely
crazy.
And as we
connected.
age, we have less saliva, and saliva is mostly water, right? And so if we have less saliva, then we don't have lubrication or protection against. Saliva has enzymes that help protect our teeth and our gums, and so makes us more at risk to a lot of other issues too.
Wow. So talking about, protecting us from those issues, we hear a lot about fluoride, right? And fluoride is great for teeth health. But what exactly is fluoride, and do I really need it to keep my teeth healthy?
Right. It's a great question. We get a lot of patients that are kind of iffy about fluoride. They may have heard things in the news, things that they hear, watch on TV, but fluoride is a mineral that is known when it's present in saliva to help strengthen tooth enamel.
Okay.
There's an actual chemistry behind it, but what it does is it makes weak tooth enamel stronger, and any little weak spots where cavities might be starting, it helps to strengthen those.
Okay.
And so we do have fluoride in our tap water. Now more research is showing that because more people drink bottled water, they're not getting a lot of the fluoride content that is in our tap water. But fluoride is a great thing that I recommend for everyone, and most dentists do. The American Dental Association does recommend use of daily fluoride in our toothpaste. To prevent cavities and prevent other issues.
Wow, because we know when tooth enamel is gone, it's gone forever, right?
Right.
But at least this fluoride helps to strengthen what you still have.
Yes,
Okay.
that's absolutely right.
Wow, very cool. So is there a specific type of toothbrush that you would say is better than others? I know we always read the little tabs at the store. Some say soft, medium, hard. I've seen extra soft, what is best? Is there a best one for one person, or is it kind of specific to that person?
So toothbrushes and the different types, whether extra soft all the way to hard, the most recommended for the typical patient is going to be extra soft or soft.
Okay.
The reason why is those bristles are very abrasive, and so they can actually cause tooth damage or really, really put a lot of pressure on the gum tissue.
Okay.
And so I recommend extra soft or soft. There is a medium or a hard out there. Medium is more so for patients who lack manual dexterity, and so if they're not able to apply pressure, some mentally challenged patients or patients that may not have full motor function, then we recommend a medium toothbrush. But the best is going to be an electric toothbrush. You get thousands of brush strokes per minute, whereas the traditional one, you'd have to do thousands of circles each time.
Wow, yeah.
And so electric toothbrushes are amazing, and I recommend that everyone invest in one.
Wow, very interesting. Yeah, because I feel like, my husband, and not to generalize the population, but I feel like sometimes the men in my life feel like they need the toughest toothbrush out there because they're going to do the best job.
And most people do.
Right.
Most people think that it just doesn't feel like it's doing anything.
Right, yeah. They're like, I really need to just tear my teeth apart, basically.
Right. And what happens is more damage usually with that.
Yeah, wow.
And now the electric toothbrushes, most of them, like Oral-B, they do have a pressure sensor on most of their toothbrushes. So if you're brushing too hard with the manual, it kind of retrains your brain to apply less pressure, and it'll show up red and kind of train you to brush softer. To brush a little bit softer. Yeah.
Wow, that's really cool. It's what kind of stops you from really getting to, wow, awesome, very cool. So does everyone, part of the traditional dental care routine at night and in the morning, is brushing your teeth, flossing, and using mouthwash? Would you say that flossing and mouthwash are just essential for that routine that we should be having?
So flossing Absolutely. Mouth rinse, you don't have to necessarily do that twice a day. It is recommended once a day, but flossing is going to be even more important than brushing itself.
Wow, really?
Yes, just for overall gum health. I'm not saying not to brush your teeth, everybody.
Yeah.
I'm not saying that, but flossing and brushing, rinsing once a day is sufficient.
Oh, wow, okay. So we know that sugar, you know, is not really great for our diets, but how would you say that it really affects our teeth in general?
So sugar, when combined with plaque, creates an environment for bacteria, and that is a recipe for tooth decay. So you need a sugar source to have a cavity. And so sugar, when the more sugar you have, the more likely you are to have cavities form on your teeth.
Oh, so that's why we see them kind of more common in kids, you know, like candy. That's why we always like say not too much candy, right?
Right. And with baby teeth, because they're a lot thinner and the enamel's a lot thinner, candy in excess amounts, the enamel's a lot weaker. So cavities form really quickly and spread quickly, more so than on adult teeth.
Oh, okay. So would you say that there's like specific foods that would be more beneficial for our teeth now that we've seen that sugar is like not great for our teeth? Are there certain like vegetables or maybe even meats or something that are better for our teeth?
Absolutely. So whenever we deal with carbohydrates turn into sugar. So food that has not been highly processed is going to be more beneficial for your teeth. Specifically, dairy is great for your teeth, types of cheeses and yogurts that are low sugar. Milk is great for your teeth. Hard veggies are great for your teeth. Some citrus are more acidic, so they're not as good for your teeth. But to keep your teeth healthy and strong, definitely calcium and fortified fruits, vegetables, and decreasing refined sugars and you know, things that are processed, highly processed.
So by those like harder vegetables, do you mean like broccoli, zucchini, like carrots? Okay, perfect. Yeah. Just so we can kind of get an idea to like what can we increase in our diets, you know, that would be better.
So if it grows in the ground and it's not processed, it's probably going to be better for not only your body, but also for your teeth as well.
Absolutely. So is there anything else that you'd like to share with our employees, just that you might want them to know?
So it's very important, even if you don't have pain or discomfort in your teeth, to be evaluated by a professional and have your teeth professionally cleaned every 6 months. Bigger, more costly, complicated issues can be prevented, usually if we get to them early. So a lot of people say, well, I'm not hurting, nothing's hurting, so I don't need to go see a dentist. And usually when something's hurting, it's gonna need more costly, complicated treatment. So the best medicine is prevention, right? And everything we do. So same thing with our oral health. Another thing is that bleeding gums. A lot of people think, well, my gums just bleed when I brush, it's okay. And it's very common misconception. And the reality is, if there was blood on your hands, for example, when you're washing them, would you think that's okay? No, right? I wouldn't go put my hands in the dirt and rub it around because that's open to my bloodstream and get to my body. Same thing with bleeding gums. There's so many different types of bacteria that's just natural in our mouth. And so if our gums are bleeding, that's an easy way for that bacteria to get into our bloodstream and also cause inflammation in our body. So bleeding gums are not normal. And by visiting your dentist every 6 months, you can help prevent that bleeding gums and also improve your overall health. And so seeing your dentist is important. And so if you don't have a dentist, you should see a dentist and have a dentist. And as early as age, 6 months, the eruption of the first tooth, you want to see a dentist even before that to make sure that your child does not have any issues with their attachments on their lip or their tongue, which can interfere with proper feeding, speaking, and things of that sort. So everybody needs a dentist, and if you don't have one, I recommend that you get one.
Awesome. Thank you so much for joining us today, Dr. Treviño. We really appreciate your knowledge and everything you've shared with us today. If you haven't already, please subscribe to our YouTube channel and make sure to like this video.
You're very welcome.